For many of the patients I meet who've been given a tentative diagnosis of a brain tumor or a brain cancer, when I meet them and examine their MRI, it's clear to me that they have a large mass in the brain that has a good chance of being a tumor, and that the size of that tumor might be causing them the symptoms that brought them to me, like headaches, or weakness, or speech trouble. For those patients, it may make good sense to combine the biopsy or diagnosis part with a treatment part and an open surgery, which is sometimes called a craniotomy, to remove the tumor will not only give us some of the tumor to look at to make a firm diagnosis, but also relieve the pressure from the tumor and actually start help treating the tumor by removing as much of it as possible. For those patients that I meet, I usually recommend a craniotomy rather than a simple biopsy because I think it gets us farther ahead. Remember that both the biopsy and the open surgery require going to the operating room and usually require going under anesthesia. Whenever we can get a patient treated and get the best treatment in place with a single trip to the OR instead of 2 trips, that's always better. There are some risks to an open surgery. It's a surgery on the brain, and whatever part of the brain is nearest the tumor is the part that's most at risk. You would want to ask your surgeon, what are the areas of the brain that are near my tumor that might be at risk with surgery? Those are probably the same things that are getting pushed on by the tumor. So if you're weak in your right leg because of the tumor you have, then one of the risks of surgery might be to make that leg weaker. Our hope, of course, is to get the strength back in your leg by taking the pressure off it. But with any surgery, there is a small amount of risk. Usually the risk with a craniotomy for a tumor like this is on the order of about 5% chance of a major problem. Now, not all of those problems are permanent, and not all of those are irreversible, but patients should be prepared before they decide to go forward with surgery for the small chance that there could be a complication such as infection or swelling or bleeding from the surgery. A majority of patients who have a craniotomy to remove their tumor will be in the hospital 2 or 3 or 4 days, and when they go home should feel pretty good, but we'll find that they get tired very easily. A majority of them probably feel better from the standpoint of their neurologic problem, but it does take a number of weeks to really get over a major surgery like this.